Hi everyone, I'm Rob Coram. I'm the Chief Medical Officer of Penda Health, and I'm a primary care doctor. Penda Health is a network of 19 outpatient medical centers, and we're located all across Nairobi, and we provide comprehensive outpatient primary care. And so we actually take care of a huge range of different patients, from boda drivers who get in road traffic accidents, to office workers who are paying with insurance, to moms who need care during their pregnancy, babies who get vaccinated, and even a lot of our patients bring in their older parents to take care of chronic illnesses later in life. So we take care of people from cradle to grave. Penda Health was founded in 2012. We saw our first patient on Valentine's Day in 2012, back in our first tiny one-room clinic in Kitengela. And since then, we've really expanded. We've honed the model of what an outpatient medical center really is meant to look like, the number of exam rooms we have, the lab, the pharmacy, the ultrasound, the reception, and then we've replicated that all across the city. So now we're located across basically all of the major highways through Nairobi. I myself am super passionate about primary care, and even as Penda, we're so passionate about primary care. And a lot of people ask us, external folks and even our own staff, ask us, like, why do we do primary care? Why don't we open up a hospital? Why don't we open up specialist clinics? And for me, you know, the easiest way to explain this is to think of the healthcare system as a football field. We know all Kenyans love football, Sindio. And you can think of healthcare as the whole football field, and the ball is the disease. And we want to keep the ball out on the field. In primary care, we're out on the field. We're on the midfield, we're even on the forward field. And as the ball gets closer and closer now to the D, and that's where the defenders are, and then even shots on goal, now you're talking about the secondary healthcare system, the tertiary healthcare system, some of our facilities like, you know, Kenyatta National Hospital and Moi. And we don't want the ball to get all the way to the goal, because that's when we're having those advanced cases of cancer, of stroke, of hypertension. We want to be able to actually be treating those conditions while we're still out on the field, doing pap smears, controlling blood pressure as an outpatient. And so it's really good for two reasons. One, it's good for the patient, right? We don't want you to have to come into the hospital. And then the second reason is, from a health system perspective, it just takes a lot less resources when we take care of things out on the field or in the primary care setting. And that's also supported by lots and lots of organizations and research studies that say that investments made in primary care go much further to take care of the health of the population than investments that we make into more of the specialty hospital centers. Yeah, so I think technology is critically important to Penda Health's model and for how we are able to deliver high quality healthcare at low cost. The main innovation that we've made is we use a cloud-based electronic health record across all of our branches. So every single thing that's done is done digitally. We really don't use paper at Penda. And what that does is it helps streamline every single aspect of our operations, from registration and queue management to inventory management to billing, et cetera, et cetera. But one of the pieces that I'm most proud of, and I think is quite unique to Penda, is our clinical decision support. And so that's essentially the electronic tool that makes sure that the care that we provide is in accordance with national and international guidelines. One of the things I'm constantly surprised about when I speak with other medical centers is I'll ask people, like, how do you know if the care that you're providing is good? And often there's just kind of an assumption that, well, if we hire good doctors, then the care must be good. And ideally what you'd like to be able to do is ask specific questions about, like, when a child, you know, is diagnosed with a diarrheal illness, how often does that child get evaluated for dehydration, get oral rehydration therapy when they are dehydrated, get zinc sulfate, you know what I mean? And I think studies of the adherence to guidelines across all the many aspects of primary care routinely show that we don't do a very good job. as a country and even all over the world, we don't do a very good job of making sure that the care that we provide is in line with guidelines. So what our clinical decision support system does is, for over 300 different conditions that are commonly seen at Penda, it offers up, here are the recommended guidelines for this condition. Clinician, do you want to proceed with these recommended guidelines? And then they're able to select accept or to reject. And in some cases, they may need to reject because of the specifics of that particular case, but most of the time, we think that they should be following the guidelines. And so the system helps them to know what the guidelines are. In primary care, it's tough. We're seeing, like I said, everything from vaccinating babies to ill children to malaria to road traffic accidents. And so to know all of the guidelines off the top of your head, it's impossible for any one person. And so our system really helps to make sure that guidelines are routinely followed at Penda. So we published a paper about 5 years ago about the treatment of urinary tract infection at Penda. And what we were looking at is, how do we get clinicians to really change their behavior in terms of how they're evaluating and how they're treating urinary tract infection? And how do we get them to conform more closely with national guidelines on how to treat it? And so that's really what the paper looks at. And I think that was one very, very early step which opened up the possibilities that we now have on clinical decision support. So we were looking really at 5 quality metrics. One of them was just following the guideline recommended antibiotic treatment for urinary tract infection. And in the paper, we showed that we went from less than 40% adherence all the way up to almost 90% adherence to that guideline recommended antibiotic. And so that really proved we can change the behavior of clinical officers in terms of how they're evaluating and treating primary care conditions. So now why don't we expand that to dozens and hundreds of conditions that we're seeing in the primary care setting? And that's what our clinical decision support tool does. What's exciting about clinical decision support in the electronic health record is we're able to do it at a scale that we were not able to do before, and we're able to have immediate feedback and insight into how that's going. So myself and my clinical leadership team can look at our dashboards and see exactly the levels of adherence to all those 300 plus conditions with the click of a button. We can look at it in our branch in Kawangware, we can look at it in Kawa West, we can look at how last week compared to the previous week. And so it's just this incredibly powerful data-driven tool to really assess quality at that very detailed level. We are currently about to publish a study on that clinical decision support, which is kind of what we just talked about. How do you start with something like our urinary tract infection study and now expand it to the hundreds of conditions that we have? And we have huge amounts of data on this because every single month we have more than 100,000 data points that are generated on adherence or non-adherence to clinical guidelines. So it's really like a tremendous data trove for understanding how medical decisions are made at Penda and how we can influence them and nudge them towards guideline appropriate care. Any healthcare business has to care about quality. It's one of the top things in patients' minds, and I think it's also one of the top things in staff's minds. Like, we all want to work at facilities where we're proud of the level of quality that we're providing. And Safe Care is really a terrific partner for us in helping us understand how to think about our quality and how to have that very high level understanding of the governance that's required to maintain that quality across as many as 19 branches. So the Safe Care accreditation procedure really looks at all different aspects of quality, from the infrastructure that's there to the staffing that's available, technology, HR practices, and they're really quite thorough and detailed. When they come, it's multiple days asking questions of frontline staff to understand what's really happening on the ground, not just what exists in an SOP. And so I think all of the preparation that goes into that, and then of course ultimately achieving the Safe Care accreditation, really helps us pay attention to quality, like not just as a single moment, but as a constant journey that we're moving through. One other thing I would like to say about quality is that a lot of times doctors tend to define quality in sometimes maybe a narrow way. We look at things like guideline adherence or diagnostic accuracy. But I think one thing that really defines Penda is our focus on patient-centered care. And when you talk to patients, there's many other dimensions of quality that really matter to them outside of just those things like diagnostic accuracy. How you're treated at reception really matters to patients. It's not something that you can kind of forget and say, oh, well, that's not really quality. That is quality. How you explain a diagnosis to a patient, how you explain the treatment process. If you don't take the right amount of time and care in those things, that patient will go home and they won't follow your treatment plan. So then what was the whole purpose of providing the quality as defined by doctors? So Penda really tries to look at the overarching view of the patient experience from the patient standpoint. And I think that's something that is really like unique and special about Penda. So we've talked about how technology really supports Penda's branch operations, but there's a lot of very exciting things happening in the innovation side for Penda, and I think you mentioned telemedicine. Our fastest growing service right now is called Pigia Penda, which is our telemedicine service. It's on demand. You can be talking to one of our clinical officers, the same clinical officer providers who work in all of our branches. We have some of them in our Pigia Penda call center. They are on demand, so you don't need to set an appointment, you don't need to download an app. You just call our number or you start a chat through WhatsApp and you're speaking with them. And that telemedicine is something that I think is still new all over the world and especially in Kenya, and we're trying to help patients understand how a lot of issues can actually be solved over a telephone call. And I think as more and more patients are taking that up, they're really seeing that. Technology is really what unlocks our ability to do that in a very consistent way and in a way that is very convenient for patients. So that involves call center technology. It involves our cloud-based health record, because one of the cool things about using Pigia Penda is that if you've ever been to one of our branches, it's the same medical record that exists at any of our branches as what our clinical staff are using in Pigia Penda. So if you call us and we look up your phone number, that clinician is able to access your records from any of the branches that you've been to. They can see which treatments you were given, what your lab tests are, all of those types of things. And then that same record from the telemedicine visit is now available if you need to come back to the branch. So we call that blended healthcare because it means that you can kind of bounce back and forth between the brick and mortar and the digital. I think it's very, very important as we are trying to make care more affordable and allow people to consume care in the ways that make the most sense for them, right? And if you're a working mom and your child is sick, it saves you so much time and even saves you money if you can just call, tell them about what's going on with your child, get a provisional diagnosis over the phone, have drugs delivered, and then you can either keep working or go to your office and your child can stay home and get those drugs that they need to get started on treatment. So I think it's like a very important way to unlock this kind of new model of care. The COVID period was very, very difficult on Penda, just as I think it was difficult across the whole healthcare sector. All of us were spending a lot more money on PPE, COVID testing for our staff, reorganizing our clinical spaces to keep our staff and our patients safe, paying for transport to get staff home safely at night. These were huge additional costs. And at the same time, revenues went way down. I think that's something that the whole sector experienced. Partly that was just curfew. There were fewer hours for people to access healthcare. Partly that was the economic impact of COVID and people just had, fewer resources to spend on healthcare. A lot of people lost their health insurance during the period. So I think it was like a very, very difficult period in many ways. I think healthcare workers are tired. We've been wearing masks and working 8 to 12-hour shifts for the last 2 years, under these conditions, and everybody is exhausted. So it's been really, really hard. And of course, we do always try to look for the silver linings of whatever happened. I think we learned a lot about supply chain planning. I think we learned a lot about being more self-reliant, not only as Penda, but even as a healthcare system. Like, what can we do within Nairobi, within Kenya, right here in our own healthcare system to take care of people's conditions, whatever they are. I think we learned about the importance of prevention. During the COVID period, we saw a drop-off in the number of children who were vaccinated, the number of women who were getting pap smears, the HPV vaccine uptake. And we know that those things are critical. So we need to now get back to that type of preventative healthcare. So I think it showed how important the primary healthcare system space is for the whole healthcare ecosystem. And I'm really delighted that things are opening up again now that we're kind of coming out of things. And I know it's going to be very important for not just health systems, but the whole population to kind of get back into wellness, prevention. How are we taking care of things before they get too serious? I think, the two big things that I've wanted to talk about are telemedicine and Pigia Penda, and I think we've talked about that. And then our clinical decision support. One other thing that I would like to talk about is a lot of organizations and even insurance companies are trying to figure out how to take care of outpatient healthcare costs. Outpatient health insurance is still way too expensive, and when someone doesn't have insurance, it really is a barrier to them accessing care, whether it's preventative care or like urgent care treatment. And so one of the areas that Penda is exploring is they're called capitation models for healthcare, where basically an individual or a company or even an insurer could partner with Penda and pay one flat rate at the beginning of the year to take care of all of the healthcare needs for their population or for their group or for their family over the course of the year. That's actually how the National Hospital Insurance Fund SUPA cover works, the NHIF national scheme. It's a capitation model, and this is like a very similar thing, but it's really designed for families, for corporates, and for insurers. And the price point varies depending on exactly what that organization wants to be covered. So we have packages that are really just around Pigia Penda and access to telemedicine and drug delivery. We have other packages that include medical center visits, and then others that even include lab tests, drugs. So you can kind of add on anything that you want to that package. But the end result is that you get a lot more covered, and you get it covered in an unlimited way as long as you get it through Penda. Our partners have been extremely satisfied with this kind of product. Yes, you're limited to only Penda, but since Penda is so well liked by our customers and people have such a good experience, and we're all over the city, I think it's a really good option for organizations who are trying to figure out how can I give outpatient cover to my whole team for the whole year, but really control my cost and know that I'm not going to get halfway through the year and say, benefits imeisha, or we can't keep paying this cover because costs have gone too high. The cost is fixed, and I think that's what our partners have really, really liked.